This is going to be a video on extubation and how to safely extubate your patient from mechanical ventilation when they are able to come off of it. So before you do anything for extubation, you want to make sure that you have your supplies. You should have an ambu bag in the room, and you should have already checked for a cuff leak before obtaining an order for extubation from your physician. So to check your cuff leak, what you should have done before, you want to thoroughly suction your patient down the ET tube. And you also want to suction above the cords. And then you want to deflate your cuff so that you hear an audible leak. If you don't hear an audible leak, you can also listen with your stethoscope. You should hear a leak. If no leak is observed, then that patient is not a candidate for extubation. Once you've obtained your order for extubation and your patient has an audible leak, and you have done your RISB and all your weaning protocols, then you're ready to set up for extubation. You're gonna need a towel. You have your suction ballad, your Yankawa, your syringe. It's always best to get your nasal cannula or whatever type of oxygen device you're gonna put the patient on after extubation. Have it set up and running. Always put running equipment on a patient. Then you also want to have your ambu bag, and it's also beneficial to have an incentive spirometer as well. In order to extubate your patient, the patient would be awake. You want to explain to them, "Hi, Miss Jones, you did well with your CPAP trial today. The doctor has given me an order to extubate you. So we're just going to pull this tube out. So I'm going to help you walk along the process so you know what to do." So the first thing we're going to do, we're just going to suction, okay? So big cough, okay? Suction down your ET tube. You might have to do this more than once. You want to clear the secretions. Okay, now I'm just going to suction the back of your mouth. You want to suction the back of the patient's mouth. You want your Yankawa all the way back because you're trying to remove secretions from above the cuff. So you don't want to just suction in the front of the mouth. You have to go all the way back. Okay, I leave it attached to the Yankawa because you will need this when the patient is extubated. You should already have your cannula set up and running. And of course, your nurse needs to be aware you're doing all of this. Okay, we're just going to take this sticky part off, okay? Undo your Hollister. Okay. Then you're going to attach your syringe to your cuff. Okay, I'm going to let you know when to cough, okay? You're going to ask the patient to cough when you deflate the cuff so that the trauma is less when you're extubating. Fully deflate your cuff. In an adult cuff, you're going to need to suck out 8 to 10 mLs. All right, cough, 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 cough. Good job. Immediately suction. Immediately put on your nasal cannula. All right, I'm just going to lift your head. We're just going to put a little bit of oxygen in. Can you tell me your name? Why I'm asking the patient to tell me their name is that I'm assessing for the presence of stridor. If someone tells me their name and I hear stridorous sound, then I know that patient might need something called racemic epi to reduce swelling. If I do not hear stridor when they tell me their name, I will definitely document that. If I hear stridor, document as well. Okay, so now you want to remove, you want to leave your Yankawa. If you need to cough anything up, cough it into this, okay? Then remove this, and of course you would have taken your vent off and disconnected everything. Each hospital policy is different. Usually we leave the vent in the room for at least an hour to make sure the patient doesn't have to be reintubated. The next thing we're going to be doing is incentive spirometry. So based on the patient's gender and height, you'll know what your expected volume should be. In this case, my expected volume should be at least 500. The goal is to have the patient suck in and hold their breath. Okay, Miss Jones, so I'm going to have you take one deep breath for me. This is at least going to help make sure that your lungs stay nice and inflated. Now you have the tube out. I just need to make sure you can do this. After this one, I want you to do this every hour for at least 5 to 10 times, okay? So you're gonna put this in your mouth. Deep breath in. Hold, 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 hold. Good job. Thank you. All right. All right. Thank you for watching this video on extubation.